Slide 1. Welcome to the Certified HIPAA Privacy Associate Training. The purpose of this training is to provide an overview of the Health Insurance Portability and Accountability Act and the provisions that were incorporated in that impact the healthcare industry. Specifically, this training is intended to address privacy and security requirements that were incorporated in the HIPAA administrative simplification provisions in addition to the overview. Slide 2. Now, the Health Insurance Portability and Accountability Act was passed by Congress in 1996. It was an omnibus act that covered a number of healthcare-related privacy and security, as well as fraud, transactions and code sets, the movement of group plan to group plan coverage, and so forth. So it was a rather large act. Title I of HIPAA protected health insurance coverage for workers and their families when they change or lose their jobs. In other words, they could move from one group plan to another without the insurance company imposing a pre-existing condition clause. Title II, which is what we will be focusing on as this part of the training, is the administrative simplification provisions, and they required the establishment of national standards for electronic health care transactions and also national identifiers. This included the X12 transactions for many of the administrative simplification transactions, mostly healthcare administration transactions. It also included NCPDP transactions, which are primarily for the prescriptions and similar benefits or claims. It also covered national identifiers, which included the provider national identifier, which has been finalized and implemented, the employer identifier, which also has been finalized and implemented, the health plan identifier, currently in the process of drafting a rule, and then patient identifier. Now, patient identifier was later retracted by Congress, so there is no longer the inclusion of patient identifier in the administrative simplification provisions by act of Congress. Slide 3. Now, Title II also required the implementation of appropriate privacy and security practices related to the use and disclosure of what's called protected health information. Protected health information is also known as individually identifiable health information, and HIPAA just renamed it Protected Health Information. This included the HIPAA privacy rule, it included the security rule, and also associated with it was the enforcement rule, which defined how the rules would be enforced and the penalties associated with them. Slide 4. Now, the provisions in HIPAA initially provided to or covered entities. Covered entities included health plans, healthcare providers, and healthcare clearinghouses. Health plans, examples of that would be both government and private, Medicare, Medicaid, the commercial insurance, as well as self-funded plans. So if an organization decides to pay for their own health plan and have a self-funded plan, they are considered a HIPAA-covered entity. Healthcare providers, not all of them are covered under HIPAA. HIPAA specifically stated that if providers use the HIPAA-covered transactions, then those providers are considered covered entities. Now, the ASCA Act, which was passed in 2003, which extended the deadline to comply with the transaction and code set deadline, was also included the requirement that all providers report to Medicare electronically, and that made them covered entities. Now, the exclusion were for smaller providers with 25 or fewer employees or 10 or fewer providers, and those particular providers, if they elected to continue reporting using paper, then they would not be considered covered entities under HIPAA. Healthcare clearinghouses are an interesting breed. They are considered both a covered entity and they are also considered a business associate. And the way to look at healthcare clearinghouses is they're translators. They take transactions from the provider, and then they may or may not translate those into HIPAA-covered transactions depending on whether or not the provider generated a HIPAA-covered transaction and then transmit those onto the health plan. Now, the provisions were expanded as part of the HITECH Act to cover business associates. In 2009, the American Recovery and Reinvestment Act, otherwise known as the stimulus package, was passed, and included in that was the HITECH Act. And the HITECH Act not only included provisions on how to expand the use of health information technology, but it also included in Subpart D additional privacy, security, and enforcement provisions.